occupational therapist, and I went to Washington University down in St. Louis, and they didn't have enough snow, so thus I made my way back up north. So to start off with, what I want to do is at least a nutshell of what OT is. Most people, when they think occupation, they think, oh, it's my job. It's what I do. You're going to help me find a job or work within my job. I'm going to ask you to take one step back and think of your job as what you do, small frame of time, from the time you wake up in the morning to the time you get ready and you're off to school or off to work. You have to figure out, you get yourself out of bed, no one's there to help you. You have the clarity of mind, maybe after a cup of coffee or two, but to look in your closet and decide, this is what I'm going to wear. You can organize your thoughts enough to brush your teeth. You have the physical ability to brush your teeth, take a shower, wash your hair, go to the bathroom all by yourself without somebody else helping you. Most of the patients we work with can't do any of these things, not by themselves, and that's where OT comes in. The occupation is what you do to keep yourself independent every day, and it's as little as squeezing out the toothpaste onto your toothbrush, because you know how much you like it. So that is OT in a nutshell. We're in there every morning helping them get dressed, helping them figure out, how am I going to take a shower, how am I going to manage going to the bathroom. So you get into more of that personal space where they really have to trust you, and you really start kind of building that bond. When I first started out, I actually wanted to do OT with pediatrics, and specifically in the NICU, in the neonatal intensive care unit. So you can work from just at birth all the way up through the end of life stages in a nursing home. We work with not only physical disabilities, if you've had a brain injury, if you're working towards that end of life and you have some dementia, OT works with the cognitive piece and either some retraining or how do I adapt to make things work. As we age, a lot of times our vision gets lower. We work with vision issues that patients will have. We work ergonomics in an office, in a factory, to try to reduce those repetitive injuries. Schools, as pretty much everyone says, you name it, OT can be there. So it's a great place to transition. And I may want to do peds now, and then I may want to change and do nursing home later. I don't have to go back to school for that. I just have to apply and just switch my train of thought a little bit, and I'm ready to go. No, there's always going to be patients that don't do as well, or there's going to be those patients that just blow your mind. They do more than what you ever dream. And so it is definitely a balance, and it's those patients that succeed and go forward that help you through some of those more difficult ones. Here is actually a toy/tool that we get to use. All right, so I'm somebody who has a higher threshold, and actually I have a very low threshold too. What this will do, and we'll see if we can't get it, may or may not, but what it will do is it will actually open up your hand for you, and it can actually close your hand for you. We can use it so it can exercise, so they get the strength to start using that hand by themselves. In my patients, if they're unable to have that grasp, and it's probably not going to come back because of their injury, give them a grasp, and now they can scoop up their own food and they can feed themselves. They can hang on to a toothbrush and they can brush their own teeth. They want to go out with their friends and have a drink, they can now grasp that cup by themselves and drink it by themselves versus waiting for somebody to hold the cup up for them. So thank you very, very much. So yeah, that's the physical aspect that we got to kind of work with. It can be adjusted, but that's just one of the many toys. St. Mary's has a fabulous foundation. They have a lot of foundations where we get a lot of money for these tools to help. And a lot of our tools, they aren't cheap. They're anywhere from, I'm not exaggerating, $50,000 to $80,000 sometimes for these things. So we're at the top of the technology. Most places within really even the tri-state area don't have a lot of the things that we use within our rehab center. So kudos to our foundation for allowing us to purchase these things.